Okay, well, we want to say thank you for coming to our next session, the Ask Us Anything special topic talk on careers in global health. Um, Today we have an alum that is here to talk about her journey in doing work in global health, and just to have some kind of very informal conversation, Q&A kind of back and forth. So I really encourage you to be coming prepared with some questions and have some things you might want to ask. If you do have questions, you can certainly put them into the chat. I'll monitor that and leave them there. And then also, at the end, we'll definitely have time for anybody that wants to unmute themselves and ask questions. But to get started, let me first give a quick introduction to Luana. Luana is a medical doctor, an infectious disease specialist and health educator and practitioner with over 10 years of experience in clinical and research-based institutions in Brazil in primary and tertiary care. She is work as a public health consultant for Brazilian municipalities and large media groups. And currently she is working as a public health international consultant for the World Bank, working on projects related to COVID-19. She's a recent graduate, so I just found out she finished her program in August, and she has a ton of different things that she's done. So I'll turn it over to Luana and have you share anything more about yourself, and then we'll go from there.
Yeah, so thank you, Paul, for having me, Paul and Caroline. I'm very happy to be here. I think that those events are super important for those who are currently studying at Hopkins. They were important to me by then, so I think that it's a very nice opportunity, and I'm glad to be part of that at the other side right now. Well, I just want to say that I am Brazilian, as you may see. I worked in Brazil for most of my career. I'm Brazilian, but I think that that the vision of coming from South America, which is usually a little bit neglected in global health, is something that is very important, and it's a game changer for me right now. So I hope I can talk about a little bit about this topic while we clarify other situations, because I think that's where you come from and what you bring with you is as important as what you learn at Hopkins, and knowing how to blend those informations is crucial to conquer the career that you are going for. So
yeah. And I think it's very interesting too, because I think when many students think about global health, they think about African countries, they think about, Southeast Asia and things like that. So, I think you're right in terms of, anything in South America, Latin America, anything like that. I don't think, many times students are thinking about that.
Yeah, that's true. And it's very interesting because I think that global health is a little bit biased in this sense, majorly because of the donors and where this money goes to. So when you have a continent that, as I am in, that can provide for itself, it's a little bit kind of outcasted from the global health situation. So yes, when you think, especially when you think about low middle income countries, you definitely think about sub-Saharan Africa and Southeast Asia and everything else. But there are opportunities everywhere. And now, for example, I work with the World Bank on projects in Brazil, in Cape Verde, in Guinea-Bissau, and under the South Korea leadership as well. So there are a lot of things that we can do. But again, I would love that someone could pay a little bit more attention on, on those countries like Brazil, like Argentina and Chile and everything else. I just also want to say that this is a very real life example. I am the first student to ever receive the summer scholarship, the first Brazilian to ever receive the scholarship, the summer scholarship. So as you can see, I mean, the summer scholarship is there for a long time. And only last year we had a student earning that scholarship. So that's very significant.
And maybe you could just touch a little bit about what the summer scholar is and kind of what they are kind of tapped to do while doing their training at the school.
Yeah, sure. Well, the summer scholarship is an aid for students from all over the world. There are, as they say, outstanding in their own areas, and they can bring something different to the MPH program and also learn a lot of things from the MPH program. So we have some different trainings while at Hopkins, some psychological training, some interviews with major personalities, some career experiences as well. So it's a very, very interesting program. It's not something that, of course, diminishes the rest of the MPH, because it's absolutely amazing. Everything is amazing. It's just like a small group that has some different activities that goes along with the MPH. And yeah, so I had an amazing group last year with me. So
awesome, great. So again, I have some questions that I prepared for you, and but I really encourage students, if you do have questions, to kind of feel free to put things into the chat. I'll be sure to ask.
please.
So one of the things I did want to start with is, what advice would you give to any student or an alum that is interested in wanting to go pursue a career in global health or international development, or kind of outside of doing domestic work in public health? What either advice were you given, or advice would you give?
Yeah, I think that it may sound cliche or obvious, but it's not, neither cliche nor obvious. It is go beyond your own boundaries. You know, we have the we are educated to learn a lot about our own environment, and that's awesome. For example, when I went to Hopkins, I knew, and I still know, of course, a lot, and my main focus is my country, which is already inserted in global health when you think about what we're talking. But in order for me to work in other countries, I really do need to step out of my comfort zone. So never be afraid of step out of your comfort zone. Learn a lot about the other countries, not only about public health, it's about learning their history, their you know, their geography, their political system, and be prepared to focus on those issues, those public health issues, in the light of those other variables. Also understand exactly the limits and the benefits of the organization that you're thinking about, or you know, the tools that they are offering you to do this kind of thing. But mainly is going beyond your own boundaries. I think that's the most important thing. So just for a quick example, when I got to Hopkins, my idea was to work with Brazil, and Brazil, period. You know,
Okay.
I'm going to Hopkins and to do this, and I had already a lot of, you know, preconceived ideas in my head. And when I got to Hopkins, I got two major lessons. The first one is, never think that you have everything under control,
right,
because you are exposed to so many amazing situations that you really need to, you know, let loose of all that certainty and, you know, all of the stuff. And the second one is that doesn't mean that you are losing or really changing anything. You're just like adding to your experiences, so you can even go back to your first project, but with such a, you know, a large mind at this point, that it changes everything. So don't be anxious about this kind of thing. Just like be really open to all experiences that Hopkins has to offer, and it's a lot. You may get anxious because it's so much that you don't know where to look at. But just like follow the path that you are going to learn the most.
Right.
Anything that you learn from that moment on will be serving you at some point when you go to a global health career.
Yeah, and I agree exactly with what you say. And it's funny that you say it as a student that's just been through it, and that is exactly what I hear from students all the time. Is they come in, you know, over the summer, they come in the fall, they're like, okay, I'm getting this degree to really do this. I want to go do this. And especially too, when they're international, an international student that's coming from another country, they are usually thinking to themselves, I really want to learn these skills, gain these skill sets, and then bring it back to the country that I'm from, or bring it back to the community that I'm from. And then they get here and then they find, oh, I'm really interested in this. And then they get very anxious about that kind of career pivot, and trying to reassure students to know it's like, no, that is the norm. That's exactly what happens.
It is.
More people than do it than not. Yeah.
It's crazy, Paul, because I heard that at the same point in my, you know, during my time at Hopkins, and I was so sure about that. I was like, yeah, I know what you're saying, but you know, I come from Brazil. The thing is that I had such a heavy weight on my shoulders. Like, I am the first Brazilian summer scholar. I mean, I went to Hopkins because of a program in public health that I developed in Brazil. So I had this entire path absolutely and, detailedly built in my head. And then you understand that maybe this is not the best path, or this is not maybe the best way. And then you evolve to something much bigger than you thought before. So don't be anxious about the path itself, but focus on learning, which I think it's going to serve you for the rest of your life.
Yeah. So then I guess that'll lead to one of my other questions is what skill sets do you think are really important to be able to do work in global health? And then we can, I'll have a secondary question to that, but like broadly, what do you think are the good skill sets to have?
Yeah, so what I think that especially Hopkins got me is I think the forte of Hopkins, which is the quantitative skills. You need to know about statistics. And I know that people really freak out about that a lot of times, but just don't, just like, listen to Marie. Marie is the key, just listen to that, because especially now when we are talking about, all those crazy scenarios that we are dealing with COVID and all the parallel problems that keep happening, in spite of us being focused on COVID, it's really key to understand exactly what you're saying and where and how can you present yourself in this scenario. So I think that learning and knowing about statistics is key, but also understanding communication. So for me, at this point, is the most important thing. I think that everybody that is listening right now will understand that if you think about the COVID-19 scenario, which is maybe now the major topic in global health, you need to, there's a lot of science being done, good and bad science. So you need to understand, you need to believe in yourself that you know how to identify good science. Even if you're not producing it, you need to understand how to identify that, so you know exactly what you are going to talk about. Because once you leave Hopkins, whatever you do in your life, you are a public health leader in your own set. So knowing exactly what is going on and what is good and what kind of information to trust is absolutely mandatory. And the other thing is how to communicate and how to present that information, not only for the science community or the governments that you are going to talk about, but mainly for the people. The people is what we do for, it's for them. Right? And they really own situations. And now, especially now, when governments are trying to, for example, provide the vaccination programs, we are facing a lot of different reactions from population. So if you don't know how to untangle all the issues that people have in mind, you will get in trouble. So knowing quantitative skills and knowing how to communicate, I think that, gets you far.
Yeah, and a thing that I've heard, either I've said or others have said, but I really truly kind of believe is that the school, not only does it teach you the quantitative skills, but it teaches you how to think. It teaches you how to think, differently than you had thought before about solving any type of healthcare issue, no matter whether it's health system strengthening or if it's dealing with a disease or whatever it is. It just gives you a different perspective on and a different kind of toolkit to be able to use to be able to solve various public health problems.
Even if you come from a career that is very successful, as I had. So just by being exposed to so many different people at the same time from all over the world, focused on the same topic, which is public health, is absolutely different from anything that I had before in my life. So that only is a very powerful learning process. And the other one is to understand how that specific skill set tool can help you to better communicate with all those people and understand what they are going through. So when you communicate outside Hopkins, when you're in real life and you want to do something in global health, you have a common language. Because we do have a lot of differences, right? We have differences in language, in culture, and a lot of stuff. But when it comes to numbers, that's our common language. So knowing that, and then of course, again, communicating and respecting and understanding where those people come from, I think that's the major lesson that I had at Hopkins.
Great. And to me, another thing too that I was gonna also to ask about. So I know a lot of times students are very much kind of keen on wanting to know, like, what classes should I be taking? What skill sets do I absolutely need to have to be able to do this? Should I concentrate or customize if you're doing an MBH? If you're already in a master's program, you have your courses kind of set. So should I do a certificate? How important is that? So I guess, being a recent student, going and working, what do you find to be more important? Is it the kind of the broader experiences to be able to get, or is it like, oh, I really want to take this class?
Well, I think that my example is, I don't know if it's too specific, but I don't think so. I think that, someone can learn from that. I had a very successful career as a physician, as you said, as an infectious disease physician. I worked with primary and tertiary care. I worked with government and private sector. So I had some kind of, good background. So when I got to Hopkins, and I first took a look at whatever they had, to offer me, I understood that I didn't want to concentrate at all. Yeah. I knew that looking back, and this I think is something important, looking back at my own skill set, I knew that I missed some of those pieces that I could find in different areas at Hopkins. So I wanted to customize my program, and that's what I did. I wanted some things in politics. I wanted something in statistics. I want something in communication. I knew that I needed to have some different stuff. So I think that the first tip is, when you're going to understand what you are going to do, like choose what kind of program you're going to have, first look back at your own skill set, analyze your structure so far. And that's, I think it's the most important thing. After that, that you can change a lot of stuff during the program. So you don't need to be attached to anything. I had classes that I really loved, and I had classes that they were not exactly the best thing for me, but they were there, and I always learned something from that. But there's something that it's quite interesting, Paul. So for example, I only audited one class during my entire time at Hopkins. And that class, specifically that course, was the course that led me to know the person that got me to the World Bank.
Oh, wow. Okay.
So that's the thing, you never know, tip number 2, at Hopkins, at Hopkins, you never know. Where are you going to learn, or where to going to meet someone that is actually going to change your future. We think a lot about, preparing for interviews and preparing your CV and resume. It's obviously important. It has to be there. It has to be solid. But everything that you do, especially while you are at Hopkins, is it's something that is being observed by a lot of people. So, be there, there, understand the opportunities, because that's the key.
Okay. So, so maybe what, you could talk a little bit about the work that you're doing at the World Bank. I know that's certainly a place that students would be very interested in wanting to work at, but also to other, very similar type of organizations like World Bank, UN, WHO. Many times these are the places that students say that they're very interested. So maybe you could talk a little bit about how you navigated to get to, at a place, and like you had just alluded to, it's a little bit is the networking or the kind of having those open conversations. But what do you think is going to be good for anybody who's looking for that?
Yeah, sure. So I think that it all began with my broad interests at Hopkins, right? So I wanted to pursue, first I wanted to go back to my country and, government, Brazilian government and this and that. And then I understood that, maybe I can learn something from other countries. So I decided to open my my course choices to something that could be useful for a lot of different scenarios and not only for my country. So that was my idea. So I was very open to all of the opportunities. So I went to this course. Unfortunately, this course is not being taught at Hopkins this year, but it is amazing. It is a course that is taught by Professor Mariana Sokol. She is Brazilian. She's the only Brazilian faculty right now going on. So you can reach for her if you need something. So I went there, and by the end of the course, it was it was the day before the finals, the statistics finals. But I was very good at statistics, so I went to the class just before the test, and there were very few people there. I'm just telling this story so you can understand exactly, what led me to the bank. So it was my broad interest in global health, but it was my presence there at that moment in that class, because I got to know this person that was super um, um, super passionate about the topic as well, and we got this chance to talk. And of course, that everybody aims in global health. A lot of people aim to go to work to World Bank, at UN, and all those international agencies. I at some point I also wanted to, but what got me there, and this is the interesting part, I didn't apply to none of those situations. I had a very strong resume. I was very passionate about the topic. I was very focused on what I should learn to go there. And I also got lucky because, and that's never luck, right? But I'm just taking that to that word because COVID happened.
Right.
And people needed an infectious disease specialist with a solid background on public health and statistics and communication and a lot of different stuff. So a couple months after my, actually not after mine, because I graduated in August, right at that point that I was about to graduate, World Bank got in touch that they wanted me to perform this presentation about dengue and COVID-19 in low middle income countries, this dual epidemic. And from that, and I think that was my interview. My job interview was that.
Yep.
And then after that, they reached offering some other projects. And of course, I said yes. It's a very interesting environment. So for those who have no experience dealing with those agencies, it's an amazing opportunity. You really learn hands-on how to employ everything that you learned so far, that you learned so far, not only at Hopkins, also outside Hopkins walls, dealing with the Baltimore community, dealing with international students communities, learning how to do this, interacting remotely, which is not an easy task, and we are all learning to do it. So that's what got me to World Bank. And I must confess that as a summer scholar, we actually visited World Bank once. And at DC, and we were all like, oh my god, World Bank. And we asked about how to apply, and everything seemed very, very distant. When it finally happened to me, and in that way, I was like, you know what, it's not that distant.
It was much easier than you thought.
It's only about knowing yourself and knowing how you can contribute, and explaining how you can do that in a way that it makes you interesting for them to work with. I think it's all about presenting.
And I think it's very interesting is to many times think about, and especially in global health, where I think it's a bit different, is that doing project-based work is important. Like doing, like you say, a presentation, that was your job interview, but you're not thinking about it at the time as something that needs to be, that it's leading to this job and that it's going to prepare me for it, but it's like, I know a topic, I'm passionate about a topic, I find other people that are passionate about a topic, I share with them what I'm interested in, and have these kind of casual conversations. And then a lot of times it can lead to somebody saying, well, would you want to work on this with us? Or we have this that we need to do, can you work on it? And I think I think students too have to kind of realize is you do have a lot that you can contribute. Your training has prepared you to do a lot of different things. And
even if you think that you don't, right? Even if you think that you don't. So one thing that I thought about myself earlier, while at Hopkins, is that, I come from a country that people don't pay attention to in terms of global health. So why on earth would they hire me to do something that they, in another country that I don't know so far, and maybe they have other people that know that country better than I do, so maybe they will go for that people and not that person and not me. That is not the point. What you learn since you are beginning your educational career is is as important as everything else. So coming from Brazil actually got me, put me in a good place at this moment, because I know Brazil is in the kind of in the middle of the country line.
Right.
We are
Right.
not that poor, we are not that
No.
rich, so we have
Yep.
all the problems and the benefits, and whatever you take from that entire pool, I can found it in here. So that also gave me the power to discuss situations that, although I didn't leave that in those countries, I can relate to, because I come from the environment that I come. So doing that, and again, being open to everything, learning constantly, never stop learning. And if you think that Hopkins deadlines are tight, you have no idea what that means.
Right. Right.
You have no idea. So
Yeah.
learn how to work fast and efficiently. And for that, you have to be constantly learning and ahead of everybody else, in the sense, right? So if there's something that you think that may happen, you go there and you at least take a look at that, so you can be prepared for when that happens, you have something good to say about it.
Right.
So it's always about being in your toes.
Yeah, exactly. Well, and I think about too, this idea is that there's, if you kind of listen, I call it listening with the third ear because it's coming from my counselor side, but it's kind of paying attention to the opportunities in conversations, is to hear what somebody says about what they do, and then think to yourself, oh, maybe that's something that I can help out with. Maybe it's something that I can contribute to. Maybe it's something that I could see that could be something to explore because I'm interested in that. And to really kind of treat them as these chances for you to, like you say, constantly be learning more, but also to at the same time preparing and setting yourself up for potential future engagements. Because again, it's this idea is that there's no kind of direct path to say, we'll do this, and then once you complete this, you'll do this, and once you complete this, you'll do that.
Yeah, this is not true at all. And the thing is that I don't think, at least for me, I was never presented with the clear path to work on those organizations.
Yeah.
And I do believe that there is no path. There's no such a path. What there is be the best you can be in the topic that you are passionate about. Because those people, what they want is the best of the best.
Yeah.
The best fit for that job. So it's all about being the best fit for that job. So if you really want something, if you really love something, you go for that, and suddenly you will find the opportunity through networking, or through the career service, or through, as it happened to me, just a quick chat after a class.
Right. And yeah, that's good too, because someone had asked a question of, do you have any suggestions for someone who's interested in working in international organizations like World Bank? And I think you just kind of alluded to it there, is have conversations with people that are passionate.
And there's something else. For example, I have a very, very dear friend of mine that I got to know at Hopkins, and she's an ophthalmologist, and she now works, and we never saw that coming as well, again, because we were not aware of how to do this or how to get to those places. But now she works for the UN, and she's a very specific kind of knowledge. She has a specific kind of knowledge on ophthalmology, and because we always talked about being broad and learning a lot of stuff and understanding your background, where you're going to, she for a long time was like, I don't know if there's going to be a place for me, because this is my background, this is where I come from. And guess what? They needed someone exactly with her background and knowledge that she got at Hopkins.
Yeah.
So I think that's the key. Being the best version of what you want to know, and being open to don't be afraid of challenge. Don't be afraid of being defied in your comfort zone, but be sure about who you are and what you love, and the opportunity may come.
Great. So just so everybody knows, we got about 10 minutes left. So again, if you have questions, I will leave open right now. This is a chance, if you want to unmute yourself, introduce yourself to us, and ask a question. We would be, really grateful to hear from many of you. If If I get too much silence, then I'll go back to one of my other questions. But yeah, see if anybody has anything.
Hi, I have a question.
Hi.
Hi. And actually, I guess maybe a little bit of a two-parter. So I myself, I am Estonian American. So I grew up in the States, but the past 4 years I lived in Estonia, and I just came back to the States 2 months ago. While in Estonia, so I'm a mental health professional and I'm an MHS student, the mental health department. And so I was already a mental health professional prior to going to Estonia. I put a lot of effort into trying to kind of expand on mental health and try to, like, you know, bring up more services there because they're just really behind in them. And so Estonia, you know, it's Northern Europe, but it's also one of the like ex-Soviet like bloc countries. And so in terms of so I guess I have two questions actually. So one question is, I had a lot of resistance from Estonians there about me working, about me trying to do more. There was so much resistance, and they kept on being basically like, it's because you're American, even though I'm also Estonian, but my education was from the US, also within mental health, at least there, but I kind of found it in other areas of Europe because I did some volunteer work in Turkey, but through like the EU. If you didn't have a degree in specifically psychology, then they were like, oh, well, that doesn't count. So my degree is from Drexel University in music therapy and counseling. So I'm a master's level mental health clinician, but there it's kind of like, oh, that doesn't matter. So it was always me trying to somehow express like, okay, these are my knowledge, this is my scope of practice. You know, like my degree was still higher than the bachelor's level of psychologists that they had. And so I'm wondering, the first question would be, is having like Hopkins now as a degree, does that really kind of give you more cred if you're international then? And then the second question, since you are at World Bank, one of the things that I've looked at is, so Estonia is not considered an LMIC country, but actually, like, I still don't understand how World Bank has not given it that status, because there's a very small percentage of people who are like, you know, more higher class. The rest really are lower and, you know, middle, but a lot of lower class, or like the income. And so I'm just wondering, like, in terms of global health and being in the program now since the end of August, you know, so much focus when you look at the global health is on these smaller countries or something, you know, in Africa. And okay, I can't compare quite Estonia or the Baltics to certain countries in Africa. However, they are still so lacking, and compared to other countries, let's say in Western Europe or definitely to the US, you know, like they still need more help and more, you know, like funding. And so kind of trying to figure out, like, or I've been trying to figure out, okay, how can I even help that? You know, is there a way to get more support for those countries who technically, according to World Bank, are doing really well, but actually when you go there, you know, the living wage compared to the cost of living, like no one's getting by. So
thank you, Lena, right? Thank you for your questions. So the first one is, does Hopkins name attached to your CV or resume changes something? It changes everything. Everything, with all the letters. The thing is that you may be super competent and super, you know, smart and passionate and this and that, but having that attached to your CV, it's a worldwide renowned institution. So it really changes a lot, but it's not enough. That being said, right? It's not only because you come from Hopkins that you are automatically approved for anything that you do, but again, people expect much more from you because you come from Hopkins. So this is something quite important. In terms of, so the second question, I think, well, of course I cannot respond for the World Bank, but what I can tell you is that this perspective of yours is, it's mandatory. It's absolutely important and necessary, because when you have the when you have the experience to know about the country, and that's what I'm talking about, that you have to learn about everything, all the countries that you're going to work with, but knowing your community, knowing your population, understanding that you are part of that, and not only part of the government or the international organization, because there is this huge gap that you identified, right? Mm-hmm. There is this gap between government and international institutes and what really the population feels. Mm-hmm. So if you know that and you are trying to work here, you can be this kind of bridge between those two situations. So now at World Bank, I see that, for example, I'm working with projects on vaccination, on COVAX initiative, right, for low middle income countries. So of course that I need to know how the bank is going to employ the money and what are the information that the bank needs to better provide this money to help the country. But I also need to know what the government is actually talking about and what is their perspective. But at the same time, I need to know how to communicate that to the people. And if I'm part of the people, I know that better. Mm-hmm. So understanding all of those different perspectives gives you an amazing power, an amazing tool to work in those organizations. Mm-hmm. So it's not only about being part of a single thing, it's understanding that you are how can I say that, Paul? Multifaceted. I don't know if that's the word. So so you are a multidimensional being, mm-hmm. Professional being. So you need to be open again and learn not only from the books, but learning from the people that you are working with, and understanding how they think and why they think like that. It's because of their culture. It is not. So now I need, for example, to provide technical information for the bank for those projects, but at the same time, I need to know how to communicate people that thing is an important thing for the people to participate, to adhere to those measures. So, it's everything that you are is part of your professional career. So the idea that you have about Estonia, it's very similar to the idea that I have about Brazil. Mm-hmm. And when I first came to Hopkins, my idea was like, I'm going to build this bridge between Hopkins and Brazil. I'm going to work the fact that I am the first summer scholar. So I will have some kind, in my mind, I said, I will have some kind of advantage to build this bridge, but it's not that simple. Global health is a very solid, at some point archaic organization or situation. So changing that requires time and knowledge and a lot of people, not only one. Mm-hmm. But knowing that will get you to the place that you are more able to build that bridge. And I hope that I will be able to do that at some point somehow.
Mm-hmm. Okay. Thank you so much.
Yeah, and one more thing that I'll just add to that too. I think some of this too, like you might have to kind of educate those that you're talking to within a country about what it is that you know, kind of what your degree. But then, and it may not be that they're going to think, or that you're going to even think, well, right now I have enough of pedigree to be able to say that I know that. But I think what you can go back to kind of rely on is the name and the reputation of the school, as to say, you can identify these are the people that you work with. These are the people that These are the established experts on things that you have been trained under, and that this is a right way to do something. From a public health perspective, and that's your expertise that you have. So, but I think some of it may be is like you said, identifying the culture. What are the norms? What are their expectations? It's not going to be an easy, quick fix. There might be a lot of wrong perceptions about what what is the right degree training to have. What are the right letters to have at the end of your name? And but I think it's a slow, gradual kind of move, not just something that can happen with a snap.
But it's very rewarding at the same time. So, for example, if you talk to any of my colleagues at the MPH cohort, or the teachers that I had the opportunity to be in their class, they will say, "Oh, the Brazilian one," because everybody, they may not know my name, but they know that there was a Brazilian woman at that cohort, and they were educated by me in everything that I could do. And that's interesting because it's not only because I'm proud of my country, but I knew that at some point I realized that was making me their reference to talk about my country. So any time that they need to think about something in Brazil, people come to me because, you know, I was someone that was showing this amount of passion for my country. So now I know that if I need to know anything about Estonia, I will reach for you, Lena, you know? So that's also a key to network, I think.
Yeah. Yeah, I'm the Estonian out of my cohort.
See?
Yeah. Okay, we do have a question here. It says, can you expand on the public health program that you created in Brazil and how your Hopkins education helped you evolve it?
Yeah, so as I told you, I am an infectious disease specialist, and I work the first half maybe of my career, I worked in tertiary care, very specialized modern centers. But at some point, I realized that it was not actually satisfying me that much. So, and this is something very personal, but you know, everybody knows, so I'm not exactly afraid of talking about that. But I had a very severe disease at some point, and I needed a major surgery, and I had to stop my entire career for 2 years. And while I had to be, you know, locked at my bed, and that was, you know, I am a very agitated and active person, so that was a hell on earth. But while I was healing, I had the time to really rethink what I was doing and learning about some other stuff and understanding if that was the path that I wanted to follow. And during that time, I received this invitation to work with a municipality inland Brazil. They were facing a crisis actually in public health. It was syphilis in pregnant women. And infectious disease specialists are not that many. So they wanted someone to support them on dealing with that issue. That was really far away from my home. I had to travel 2 hours by plane plus 3.5 hours by car to get there. But I went there, and when I, with my experience, and I didn't have any public health experience by then, look at this, but only with my professional MD and my common sense, I went there and I said, okay, this and this and this are actually the roots of what is going on with you right now.
Yeah.
But then I realized that those were the same roots of a lot of different problems that they had in primary healthcare. So at the end of my 2 weeks time there, my first 2 weeks time there, I came back to the health commissioner and I said, you know what, this solves your issue. This set of decisions solve your syphilis in pregnant women situation. But if you want to really change stuff, and that will change the entire system, we could develop this program. And that was related not only to the patient care itself, but also medical and health professional education. So to make the story short, I worked with them for 2 years and we had amazing results. I developed this educational program. I went to the community and I talked to more than 5,000 teenagers about infectious diseases. I went to church because they were important stakeholders in infectious disease care, especially those related with sex. And so I really took a dive in that community to understand how to change that scenario. Yeah. And by the end of those 2 years, our results were absolutely amazing. So I started thinking maybe we could expand that. Mm-hmm. So I started looking for help. I come from the most important federal university in Brazil. They didn't listen to me. I asked for a lot of different research institutes in Brazil. They didn't listen to me because primary healthcare was not exactly the most important aspect of public health. They were very focused on tertiary care. Right. And I knew that because I came from that. So, right. But then I started looking for, okay, my country doesn't help me. Maybe someone else somewhere else in the world. Yeah. So that's how I got to Hopkins and other universities. And then Hopkins answered me saying, no, you know what? We are interested in helping you, but have you ever thought about getting an MPH? Right. And I was like, no, I was thinking about something else. But then I understood that was going to be an important experience for me. Also, Hopkins gave me the summer scholarship. And then I said, okay, now I cannot say anything anymore. Right. And then I got to Hopkins. So this is what I'm telling you. Everything that you do in your entire life And it's not only, you know, my ability to teach people by then, but it was also my ability to engage the community and change their behavior, and using their behavior to change the scenario.
Yeah.
I think that that was what got me to Hopkins, and what got me to the World Bank, and what got me here.
Right.
So it's something that I polished through my time at Hopkins, but it was something that I had in me by then. So
Yeah.
knowing who you are and knowing your strengths is as important as knowing your weaknesses. Because your weaknesses, right, it's, you know, we can easily point, but our strengths, we have to have a little bit of courage to face them, because with them comes the responsibility to use them well. But you will be able to do that. Hopkins will help you to do that. Just like be open again to all the opportunities that the school has to offer.
Yeah, and I think that's really poignant kind of feedback and advice. I almost kind of feel like it's like you're kind of molding, and like, I like the term you use, polishing. Like, you know, it's already something that you're working on that's good. It's like, but how can I make it a little bit brighter? How can I make it a little bit smoother? How can I make it a little bit more well-defined? And sometimes it's by doing more, sometimes it's by learning more, it's by learning from others, or, you know, it's, you know, kind of actively engaging it. And the other thing too, I'll think about is a lot of times work that you're doing as a healthcare professional, that's community work, that's working for a community, it can easily translate into public health work, and you'll be able to see the connections very easily.
Easily.
Yeah.
There is a sentence, I think it's saying from I think it's Tolstoy. If I'm saying it wrong, please forgive me.
Nope,
But I think it's
you got
Tolstoy.
it.
Yeah, because he says something like, if you wanna sing about the world, sing about your own community, because in your community you will find everything that you find everywhere else in the world. So if you know where you come from, and then you learn the tools to better understand that, because at the end of the day, this is what we learn. We learn how to better understand where we come from, and then we can try to expand that to some other place. But if you really focus on understanding that the community is actually where the health is produced, this field of ours is not public disease, it's public health.
Right.
So
right.
Community actually produces health, and knowing that they produce health, we have to understand how they produce health and what actually goes into that process that makes them fail, and then the disease is there, and then the disease can spread and everything else. So I think that our set of toolkits, sorry, of our toolkit, that we learn at Hopkins, and also, you know, everywhere else, mainly by listening and understanding how people do stuff. It's all about understanding that context and then putting it elsewhere. It is always going to be like that. This is what we do so far. We learn from what other countries are doing, so we can expand that to, you know, other countries that may be in the same situation. It's not different from that. It's quite simple, to be honest. But of course, that the process itself gets more complex because of everything that is involved in it. But if you just, like, you know, take a real look at it, it's exactly the same thing all the time.
Got it. Well, this has been great. We're actually over time. So so I want to say thank you so much for everything that you shared. I think I certainly learned a little bit more, and hopefully everybody else here did as well. We will have this as a recording, so anybody that wants to can go back and listen to it. And then you know, if you're okay with it, I could also I'll share your LinkedIn profile, or share some way for anybody that does have questions for you if they want to reach out to you as well. So thank you all for coming. And I don't, any last words? I'll leave it to you.
No, I just want to thank you. Thank you, Caroline. Thank you, Paul. The career service is something that is quite important for us when we are at Hopkins, at least to orient ourselves on, you know, we are surrounded by so many information that is really good to have someone that, you know, take your hand and say, you know, come here, because we can help you deal with all of that. So I thank you for doing this. Sure. People, enjoy your time at Hopkins. Dedicate to your time at Hopkins. You will never regret of doing that. And I wish you all the best in your careers and personal lives. And if I may help you somehow, just like reach for Paul and he will put
Yep.
me in touch with you.
Perfect.
See you then.
Thank you, everybody.
Thank
Bye.
you. Bye.